O2 SARS targets. Remember, the average individual should be 94 to 98%. However, patients who are at risk of hypercapnia, i.e. elevated levels of CO2 in the blood, we will adjust this most likely, more often than not, to 88 to 92%. Not always. So typical patients here are COPD patients. How do we determine whether we need to do 88 to 92 or not? Well, what we do is we take a blood gas and we look at the bicarb levels. If the bicarb levels are elevated, that means there's a metabolic compensation for the normally elevated CO2 levels, meaning that the patient is a CO2 retainer. Why is this important? Well, remember, your respiratory drive is controlled by the apneusic centers in the medulla oblongata. These are generally work by detecting elevated levels of CO2 and low levels of oxygen. If we now over-oxygenate this patient, what we are doing is providing a higher level of oxygen than should be, and that then switches off their normal respiratory centers. So we are actually going to lead the patient into respiratory rest if we're not careful. Thank you for watching.